Hello everyone. So we are going to start a new topic, that is the obesity. So we know what is obesity. So it's a very common problem in today's world. As we can see, most of the people, they are suffering from this particular disease, obesity, in our society. And the people, they used to take different measures nowadays to prevent this particular disease. So now in this particular presentation, I'm going to describe how this disease, you can say, or how this condition, physiological condition, obesity, it comes or it develops in a person. What are the factors which are responsible for turning a person into a obese one, and what are the complexities that can arise from the obesity, and how we can manage this obesity. So let's start. So with the background, let's start with some basic term like the definition of the obesity, as well as how the global researcher, they view on this particular topic. So basically, with the virtue of definition, obesity can be defined as a state where excess deposition of fat, it takes place, right? So it generally takes place in the adipose tissue, or you can say excess adipose tissue mass. So it's a condition where you will have more amount of the fat in your body, right? Now the obesity, you can say it's a disease of caloric imbalance actually, because it occurs only when you take excess of the calories as required by your body. So for example, we need at least, for example, I'm saying we need at least 3000 calories to sustain for one day. And now if you are taking a 3-time meal daily, and if you are taking, or if the total amount of the calorie you are taking, it is exceeding the requirement, that is suppose the 3000 kilocalorie, then this excess of the calories that can get stored in the body, and this will finally lead to development of the obesity, right? Now what is the definition from the WHO? Now as per the World Health Organization, a BMI, what is BMI? It's a basic index that determines whether a person is obese or not. So a BMI value which is greater than or equal to 25, it is considered as overweight. And a BMI greater than or equal to 30, in that condition the person is turned, or person is said to be obese. Now this BMI, or you can say the Quintilate index, here actually what happens, the classification of weight status not bear by the weight only. Here actually we consider both the height as well as the area of the person. So basically muscularity, height affects the weight. So the BMI index used to classify the male or a female into obese or non-obese. So what is the formula of the BMI? The BMI, the body mass index, the formula is BMI is equal to weight of the person in kg divided by height. Clear? Now you see, this is the chart. Here we are showing the value of the BMI. Now these are the BMI, amount of the BMI. So here they are from 30, they have started here obesity class 1, from 35 it is obesity class 2, from 40 it is obesity class 2, from 50 it is super obesity. And if your BMI it is in between 18.5 to 24.9, then you are having a normal weight. And if your BMI it is in between 25 to 29.9, then you are overweight. So you can calculate your BMI by yourself. So now you should know one thing, that values are age independent. The values of the BMI are age independent, and same for both the sexes. So it is not like that for female you will have a different BMI, for male you will have a different BMI. It is same for both the sexes. The next thing is that at a similar BMI, suppose we consider a BMI of 30. So at a similar BMI, the fat content in women, it is found that the fat content in the woman, it is greater than as compared to that of the man. And the BMI 30, it is considered as the threshold. It is considered as the threshold, means the minimum value to turn a person into obese, right? Now BMI in between 25 to 30, it is medically significant, and here if the BMI is in between 25 to 30, then for the betterment of the health of that person, medical intervention is always needed. Now at a given BMI, the women on the average, I already told you, have more body fat as compared to that of the man, and the mortality as well as the morbidity, it increases with the BMI, similarly for man and woman. And the risk at a given BMI can vary between populations, so it's all depends upon the body type, your genetic makeup, right? Now let's see, there are, apart from BMI, there are different other ways. So there are different other index which can be used to check the body weight. These are the Broca's index, corpulence index, ponderal index, and Lorentz formula. These are different type of formula which can be used to check whether you are obese or not. Now, causes of the obesity. So what are the causes? These are the important factors which turn a person into obese. First of all, lack of energy balance. I already told you what is lack of energy balance. The lack of energy balance means the body, it is supplied with extra amount of the calories which are actually not needed. Suppose your body need 3000 calories per day, but you are giving more than 3000 calories, so there is an imbalance. So lack of energy balance, it takes place, and because of which obesity can occur. The next one, it is the genes and family history. So it is always found that the genetic makeup of a person can turn a person into obese. And you can see in some cases, you can see some lean and thin person, those who used to take much amount of the diet, much amount of the calories, but they also don't get obese, because it's all depend upon the genetic makeup of the person as well as the family history. So it is always found that if the parents, they are obese, then the child, they somehow carry the chances of getting obese, definitely, right? The third one, it is the endocrine system. Now this endocrine system, they control or they can relate the chances of obesity in a person. So hypothyroidism, Cushing's syndrome, PCOD. Now what is PCOD? So PCOD is nothing but it is the polycystic ovary disease, right? Apart from that, drugs, there are some drugs which induces obesity. These drugs are generally the corticosteroid, antidepressant drug, seizure medication. They can generally induce obesity in a person. Then the next one, it is the emotional factors. So it is generally claimed that the persons who are generally under the depression, they have more chances of developing obesity. The next one, it is the alcoholism. The chronic intake of alcohol can lead to development of the obesity. The next one, it is the smoking cessation. So if a person who is a chronic smoker, if he ceases, if he stops smoking, then the person develop the chances of generation of obesity. The next one, it is your pregnancy induced obesity. So during the time of pregnancy, the women, they generally suffer from pregnancy, or later on after the delivery, they also suffer from the pregnancy. Sorry, they also suffer from the obesity. Then the next condition, it is the lack of sleep. So it is somehow mostly related, because those persons who are generally sleepless, means those are insomniac, those they don't fall asleep easily, or the person who lack of sleep, who don't get proper time of sleep, so they type of person, they generally develop the chances of developing the obesity. The next condition, it is an inactive lifestyle. Suppose a person who is not having any sort of physical activities in his day-to-day life, that type of person develop the chances of getting obese or developing obesity. The next one, it is your work schedule. So the time you work, what time you work, what are the physical activities you are performing. This all actually this decide the chances of getting the obesity. Then the lack of access to healthy food. So healthy food, although they are nutritious, they also keep your body away from getting obese. Now let's discuss something associated with the body. So how this processes start. So basically you can see here a central processing system. It occurs in case of turning a person into obese. So here you can see this is a anabolic circuit. It is found in the hypothalamus, right? Now you see here it will control the energy expenditure and the food intake. The catabolic circuit is also there, which is also controlled by the hypothalamus only. The hypothalamus control both the anabolic circuit as well as the catabolic circuit, and these are some of the important factors like the leptin, insulin, and ghrelin. Ghrelin is nothing but it is a hormone which is secreted by the enteroendocrine cells of the GIT, gastrointestinal tract. So this ghrelin, it is also known as the hunger hormone. This hormone it secretes or this hormone it stimulates the appetite in your body, right? So these are the two nervous system, both the afferent and efferent nervous system, how this is related. So let's start the process. So basically you see the energy balance. The energy balance have three components. The first component, it is nothing but it is the afferent, or you can say the peripheral system. It actually generates the signal from the various side of the body, right? Now this composed of leptin, I can easily say leptin, adiponectin by the fat cells. Also the ghrelin, it comes from the stomach, and the peptide YY from the ileum, colon, and insulin from the pancreas. So first component, it is made up of these particular hormones or factors, right? Now let's come to the next component. The next component, it is the arcuate nucleus in the hypothalamus. So let's come here. What actually happens here? It actually processes and integrates the neurohormonal peripheral signals, right? Now it will generate the efferent signals. Here you can see it will generate the efferent signals, right? It is composed of the two subsets of first order neurons, right? Number one subset, it is the POMC. POMC, it stands for pro opiomelanocortin. This is the first system. The next system, it is the CART. CART, it is also known as the cocaine and amphetamine regulated transcript neurons. And these neuropeptides Y and AGRP. AGRP, it is the agouti related peptide. They are associated with the control that is done by this afferent system. And these first order neurons, they communicate with the second order neurons. So, and the last part of this is actually the efferent system. So in the efferent system, you see it carries the signal from the second order neuron of the hypothalamus to control the food intake and energy expenditure. So here you can see it is the main control. So the signals, they are coming from the leptin, insulin, ghrelin. Apart from that, adiponectin are there, right? The signal they are coming, it is coming here. Now this hypothalamus, it will control, right? So how it is going to control? The two type of system, one is POMC, another one is CART. Then the one more system is there, that is the neuropeptide Y and AGRP. It is the agouti related protein. Then from here the afferent control will control all the energy balance system of the body, right? Now leptin, we are talking about leptin. So what is leptin? So basically see, leptin is produced by the adipocytes. Adipocytes, what are the adipocytes? Adipocytes are the cells which are associated with the storage of the fat in the human body, right? Next is, it is a product of the obese. Now what is a obese gene? Obese gene is a obese gene. Obese gene means the obese gene. It is a gene which is found in all the normals, right? So leptin is a product of the obese gene. Next one, actually this leptin, it provides the signal for energy sufficiency. Now this leptin will control your appetite as well as the amount of the fat deposition in your body. Now the next one, it is the abundant fat. Now what will happen when there is abundant fat? Then this leptin, it gets stimulated, right? So you see how it's going to control. So this leptin, POMC or CART neurons, here it is going to activate the anorexic neuropeptidase, that is the MSH, as well as here also this is the process, right? Now this leptin secretion, actually it is regulated by insulin stimulated glucose metabolism. You should know that this leptin secretion, it is regulated by insulin stimulated glucose metabolism, and it stimulates the thermogenesis. Thermogenesis means the generation of heat, activity and energy expenditure in the human body. The next one, it is the mutation in leptin. So what will happen if mutation it occurs? First of all, you see MC4R, it's a mutation. It's a mutation, its genetic phase, or the full form, it is the MC4R, it is MC4R, it is the melanocortin receptor 4. There, if the mutation occurs, it is more frequent and cause of 5% massive obesity. So if there is a mutation in the leptin in the position MC4R, then the chances of getting obesity increases. So the mutation, this type of mutation, it contributes around 5% of the obesity in today's world. Now, no satiety, or you can say anorexinergic signal generated in this mutation, right? Apart from that, it behaves as if the person is undernourished. If the mutation takes place, then the person, he behaves as undernourished. It means less amount of the nutrition he is getting. Moreover, haploinsufficiency of brain derived neurotropic factor, it is also abbreviated as BDNF, brain derived neurotropic factor. So haploinsufficiency of BDNF can also cause, or it's a component of MC4R downstream signaling in the hypothalamus. So haploinsufficiency of BDNF, it is one of the contributing factor for this mutation, right? The next one is that now this BDNF, it will distort the A by W. A is the area, W is the weight, right? Obesity in the Wilms tumor andria, it's a type of aniridia, so it's a type of obese symptom, right? Now adiponectin. So what is adiponectin? So this is the adiponectin. Adiponectin, it have different receptor, adipo R1, adipo R2, which are generally found in the skeletal muscles, liver and brain. It is associated with the inactivation, or you can say oxidation of the fatty acids. So what are the process? So basically it is produced mainly by the adipocytes. This adiponectin, it is produced by the adipocytes, right? Moreover, low levels in the obesity, the adiponectin level, it comes down in the obese person, right? Now what actually adiponectin do? Adiponectin actually stimulates the fatty acid oxidation in the human body, right? Now you can also consider this as the fat burning molecule and also as a guardian angel against obesity. So if you are high, or if your body is having high amount of adiponectin, then the chances of getting obesity or obese is less. Now you see, decrease the fatty acid influx in the liver. Does this adiponectin also prevent, you see, the decrease of the fatty acid influx in the liver means it also prevents the formation of fatty liver, and also it liver glucose production, it decreases, right? Now it decreases, or you can say it protects against the metabolic syndrome. So generally adiponectin, it have a vital role in the fat metabolism in the human body. Now adipose tissue. So how these adipose tissue are going to associated, or how they are associated with the adiponectin. So basically you can see this adipose tissue, this generally produces the TNF. TNF, you know, is the tumor necrosis factor, then interleukin 6, IL-6, interleukin 1 and interleukin 18, chemokines and steroids, right? Now chronic subclinical inflammatory state, it is controlled by this adipose tissue. Now there is a link between the lipid metabolism, nutrition and inflammation. So the question is now, why it is hard to maintain the weight loss for those who lose after dietary restrictions? So this is a very common question in today's world. So people, they used to ask you that I am on a strict diet, I take a balanced diet, right? But it is always hard to lose the weight after having a control over the diet, because there are two basic reasons. First of all, you see there is a constant number of adipocytes. So once the person has become obese, he will have a constant number of adipocytes. Moreover, higher number, this adipocytes number, it is always higher in the obese person. So because of this, it is always hard to maintain the weight loss if also you try to restrict your diet. Right now, what are the medical complications of the obesity? There are numerous complications. You can suffer from cataract, you can suffer from stroke, you can suffer from CSD, diabetes, hyperlipidemia, hypertension, severe pancreatitis, even you can suffer from cancer, phlebitis, gout, osteoarthritis, gynecological abnormalities, gallbladder disease, as well as NAFLD and other pulmonary diseases. So let's discuss some of the complications which are generally associated with the obesity. So first of all, you see in case of the diabetes, so what actually happens, the insulin resistance, or you can say type 2 diabetes mellitus, 80% of the type 2 diabetes mellitus persons, they are generally obese in nature, right? What actually happens actually in the type 2 diabetes mellitus, the circulating peptides like your TNF alpha, interleukin 6, RBP6, adiponectin resistant have altered expression and modified the insulin action in the type 2 diabetes mellitus. Apart from that, what actually happens with the cardiovascular system? So independent risk factor for coronary artery disease, it is also known as the CAD. So if you are obese, then you are developing the risk for coronary artery disease, as well as CHF, that is chronic heart failure, as well as the waist and hip ratio is the best predictor for prediction of the development for cardiovascular diseases, right? Abdominal obesity associated with the atherogenic lipid profile and hypertension, and the hypertension also it is associated with the obesity. Now syndrome X, or you can say it is a metabolic syndrome. So what actually happens? Abdominal obesity, insulin resistance, hypertriglyceridemia, low serum HDL. HDL is considered as a good cholesterol, right? Plus it increases the risk of CAD, and this syndrome X, or you can say metabolic syndrome, which develops due to the obesity, it is seen more in Indian peoples, and it is probably due to the low levels of adiponectin in our body. The next one, it is your reproductive disorder. So what are the reproductive disorder which generally takes place in case of obesity? So in male, if the male he is obese, then he may suffer from hypogonadism, number one. Number two, he may suffer from low level of plasma testosterone, as well as low level of the sex hormone binding to the globulin, right? In that person, in an obese person, in male, the level of the estrogen it rises, and sometimes it can lead to the musculization, libido, potency, as well as the spermatogenesis, it is protective. Thus it can turn the male into impotent if the person he is obese. And similarly, in case of females, what are the consequences of obesity? In obese female, menstrual irregularities it takes place, oligomenorrhea it takes place, it increases the chances of, or it increases the androgen production. Moreover, it decreases the sex hormone binding globulin, as well as PCOD, that is your polycystic ovary disease, which can lead to anovulation, obesity, or you can say hirsutism. Hirsutism is the development of male-like characteristic, right? Now, obesity hypoventilation syndrome. This syndrome, it is also known as Pickwickian syndrome. Now, what actually happens with this syndrome? Apneic pauses during the sleep. So what is apneic pauses? The patient or the person, he misses the sleep due to the reason that he cannot take adequate breath. So during the time of sleep, sometimes he get rise because the body it deprived of oxygen. He feels like breathlessness, right? Apart from that, he may suffer from hypersomnolence at both day and night. So what is hypersomnolence? Hypersomnolence is nothing but it is the sleepiness. The person feels sleepy during the time of day as well as during the time of night. Means the person become sleepy, he suffers from hallucinations. Means during the daytime as well as in the night time, he always easily get sleep. Apart from that, polycythemia also means is a consequences of this type of obesity. So what is polycythemia? It is nothing but increased concentration of hemoglobin and eventually right-sided heart failure. It is one of the cases, or you can say consequences of obesity, hypoventilation syndrome. So these are the syndrome actually. The next one, what are the consequences in the GIT, gastrointestinal tract? What are the conditions that can happen if you are obese? First of all, the chances of developing gallstone, it increases. Pancreatitis, you can develop abdominal hernia, you can suffer from NAFLD, you can develop gallstone, as well as the cholesterol. Later on, you can the high amount of the cholesterol. Later on, you can develop cholelithiasis, and in 50% above ideal body weight persons, 6-fold increase in the symptomatic gallbladder stones. Thus, how this obesity controls the, or how it affects the GIT, you can see here. The next one, it is the NAFLD. So NAFLD, it is non-alcoholic fatty liver disease. So how it is associated? It is strongly associated with obesity, right? As well as this lipidemia and type 2 diabetes. We know that, right? It first of all present like a steatosis, or you can say steatohepatitis, and 10 to 20%, 10 to 20% of the person who are obese, they got finally the chances of developing cirrhosis, right? The next one, it is the, what is the consequences of obesity in the CNS? The first consequences is that the person can develop stroke. That is the first concern, means consequences. The next is increase in the blood pressure. The blood pressure of the person can increase. The next consequences, it is the development of type 2 diabetes mellitus. Apart from that, the person can have elevated level of cholesterol, I mean high amount of the cholesterol in the blood. Depression, it also, you can term it as a part of obesity, or you can say depression, it is generally also associated with obesity. And finally, the sleep disturbances. Now, what is the consequences in the bones, joints and cutaneous disorder associated with the obesity? First of all, you see the chances of getting osteoarthritis, it increases with the obese person, right? Apart from that, trauma and joint malalignment, so imperfect joint formation, it takes place in the obese person. The chances of getting or developing gout, it also increases in a obese person. And in case of the skin, in a obese person, generally they develop acanthosis nigrans. So now, what is acanthosis nigrans? It is the development of the dark patches over the skin. Apart from that, the friability of the skin, enhancing the risk of the fungal and yeast infection in obese person. And the next part, it is how obesity and cancer, they are related. How they are related? First of all, you see both the sexes, both male and female, they have equal chances of developing cancer and with a high mortality rate. So in males, development of CA here, CA is the cancer, nothing else, So in males, CA of the esophagus means cancer of the esophagus, colon, rectum, pancreas, liver and prostate. These are the chances, means a obese person develop the chances of development. In a obese person, the cancer can develop in the esophagus, colon, rectum, pancreas, liver and prostate. And similarly in the females, the cancer can develop in the gallbladder, bile duct, breast, endometrium, cervix and ovaries. Now, Cushing syndromes. So this is a syndrome which is associated with obesity. So what actually happens? High level of the cortisol is found in a person who is suffering from Cushing syndrome, right? It actually promotes the deposition of adipose tissue in a peculiar distribution. Here actually you can see in a person who is suffering from Cushing syndrome, the upper face of the person, he gets moon faces. We used to say moon faces, means moon-like shape of the upper face. Now, apart from that, intrascapular area, he may develop buffalo hump. So the hump of the person, it developed like a buffalo, and in the mesenteric bed, you can develop the truncal obesity, right? Now, hypothyroidism, this is also associated with the obesity. Now, what actually happens? Weight gain in spite of poor appetite. In the person who are suffering from hypothyroidism, they may gain weight. They may not have adequate appetite, they may not take adequate amount of food, but they may develop weight, right? And it is mainly done, or it is mainly due to the fluid retention. As the body, it retain the fluid in itself. In hypothyroidism, the person, they develop obesity, right? The next one, it is your insulinoma. That is the weight gain as a result of overeating to avoid hypoglycemic symptoms. So you can see in most of the person, those who actually feed or take more amount of the diet, they suffer from this particular disorder which is known as insulinoma, and that can finally lead to development of the obesity. The next one, it is your craniopharyngioma. So this, it is also a consequences. So the tumor arising from the or you can say reticulous pouch. So what is reticulous pouch? So it is, if you study the embryogenesis, you will know what is that. That is associated in the basal layer of the, you can say, pharynx, or you can say in the upper oral part, right? So the pressure effect on the hypothalamus because of this, and this will lead to the obesity. So these are some of the conditions. These are some of the genetic conditions like Cushing syndrome, hypothyroidism, and insulinoma, as well as craniopharyngioma. So in this condition, the person may develop obesities, right? Now, how you can manage obesity? That is the far most important thing in today's world. So first of all, you see, goal is to reduce or prevent the comorbidities. So if you are obese, now your goal should be to prevent, or you can say to reduce the comorbidities. So what are the associated comorbidities like heart failure, like stroke and all? That should be the goal, right? Now, the first thing you can start with diet therapy. You can go with the diet which contain high amount of the fiber instead of taking high amount of carbohydrate, right? Physical activity therapy. The person should engage himself in different physical activity to avoid the mass development in his body, or you can say fat development in his body. Next is the behavioral therapy. Behavioral therapy means therapy which is associated both with the patient or the obese person as well as his therapy towards the other person in the society. Next one, it is the pharmacotherapy. You can use some drug, but from my personal view, I can say that this drug, they are not a permanent solution. They can act acutely for some time, but this is not a permanent solution for the treatment of obesity. Drug like you can say sibutramine or orlistat or rimonabant. These are the drugs which you can use in the management of the obesity, but these drugs are actually short-term therapy. Apart from that, you can also go for surgery. So lastly, thank you everyone for your patience hearing. I hope you have come to learn about the obesity and how to manage the obesity, what are the consequences of the obesity. If you like my video, you can press this like icon. You can share this video with your colleagues, and for further notification from this channel, you can press this bell icon. Thank you once again.